Assalamualaikum. My name is Farisha Mirza binti Cik Mustafa. Today, my group and I going to present our project, which is Smart Health Monitoring System. First, project background. Non-communicable disease, especially coronary heart disease, are on the rise in Malaysia, affecting many people under 60. The limited use of wearable health device, which can help detect health issue earlier, contribute to this problem. The Smart Health Monitoring System aims to tackle this by introducing affordable wearable device like Xiaomi Band 9. It is also include awareness campaign, workshop, and partnership with the healthcare provider to encourage continuous health monitoring, healthy lifestyle, and culture of prevention. The next one is problem statement. Many people experience serious health problems because their issue aren't detected or prevented earlier. Despite the interest, the adoption of smart health monitoring device is still low among the residents. The absence of active health monitoring lead to late detection of health condition, increasing healthcare costs and reducing quality of life. There is insufficient awareness about the benefit of wearable health technology and proactive health management. The next one is project objective. The first objective is to raise awareness regarding preventive healthcare by implementing campaigns that curb the upsurge of non-communicable disease. The second objective is to promote health awareness through the usage of health monitoring devices that track vital health such as heart rate, sleep pattern, and stress level. The next one is project scope. Residents of Taman Tasuk Utama will test the system and provide feedback on its functionality. Xiaomi Band 9 will be brought to students and workers to affordable health monitoring. Next, the workshop and seminar with health experts will teach device usage, stress management, and balanced living. Partner with KKM and Xiaomi to demonstrate Xiaomi Band 9, promoting health awareness and device adoption. Next one is organization breakdown structure. At the top, we have Eng Kairun, our leader, overseeing the entire team. Below him is Muhammad Rashdan as the project manager and responsible for coordinating and managing tasks. Supporting the team are Nagesh as the treasurer, handling finance. Aisha Yusuf as the secretary will manage the documentation and communication. And Farisha as the planner will ensuring effective planning and execution. Together we form a cohesive and efficient team.
Good day to Dr. Mahanum. My name is Nagesh Masabam from 3 Bmkv 2/1. In this presentation, I will be presenting about risk analysis and risk assessment. The project was conducted with acknowledgement on the risk possibilities. During the project, it can occur. So there is 3 tables: risk identification, risk evaluation, risk control. Step by step, we identify risk, how we can evaluating it, and how we can control the risk. So since there is a 6 column at the risk identification, and there is also a numbering: severity, likelihood, and RPN. RPN stands for risk priority number. The higher the number is, the higher the priority that we need to give to the risk. So I directly go to the hazard. Electric shock during setup, it can occur because we are using Xiaomi Mi Band. So the likelihood is 3, severity is 5, the RPN is very high. So how we can control it? Providing surgical gloves using reusable current devices. And the second one is overcrowding causing discomfort. Since it's a community workshop, people might come a lot. So risk identification, what can be possibly happen is falls, sprains, minor cuts, and bruises. How we can overcome it, assign a safety officer to manage the crowd, control, and conduct a venue assessment. So I will be explaining about project costs in the next slide. Thank you. Next, we are looking at project cost calculation. So project cost calculation can be divided into 2: direct costs, indirect costs. Direct costs are expenses directly tied to a specific event, like a venue rental, catering, entertainment, while indirect costs are ongoing business expenses not directly linked to a single event, including promotional and marketing, transportation costs, and paperwork material. So in this slide, we can see direct costs, indirect costs, and financial summary. So the direct costs starts with Xiaomi Band 9 Active. Unit cost 89 ringgit, and the quantity is 150. The total cost around 13,350, sponsored by Xiaomi. So how many description, or how many items that sponsored by Xiaomi is: tool box, Xiaomi trainers, the equipments need to charge for the Xiaomi Band. These are the things Xiaomi have sponsored. So what are the costs that FTKM bear? Like tables, student meal allowance, lunch and dinner, and also the food and refreshment is sponsored by Dun Group. So the cost element can be divided into food, medical support, furniture, advertisement, training, and workshop. So the indirect costs are promotion and marketing, 1,250 unit per cost. The total is 4 quantity, and the total cost around 5,000. And transportation costs like petrol, 100 ringgit, and paperwork materials cost around 150 ringgit for office supplies. So the liabilities total, the FTKM back is around 300 ringgit. So the financial summary says total direct cost is around 61,185 ringgit. Total indirect cost is 5,000, and the large amount overall for this project around 66,300. So the next is work breakdown structure for our smart health monitoring event. So WBS is a tool for ease the process of event by breaking into smaller parts, and the project manager easily can identify and smoothest the flow of the program when it's happening. So what we did on the initiation plan, we form a group of 5 members. We brainstorm the project, ideas for the project, we define project objective and the scope, and we create a project proposal and submit the proposal to the lecturer. Secondly, planning. How did we plan the project? Each role was assigned. We appoint a position for each member. We discussed the roles and responsibilities of each member, what they need to do, and so on. And we estimated duration for the project. So the third one was budgeting and venue. We discussed and calculated the estimate budget for the project, and we survey and we booked the venue. We booked and we also secured Xiaomi sponsorship. So we move on to the permission and arrangement. We get approval from higher authorities. We arrange transportation for the participants. So after that, sponsorship and supplies. We secure funding from the Xiaomi sponsorship, and we paid it off to the booking and the tools that we use, and also the people that we use for the event. So the next is event setup. We set up the PA system, the chair, the tables, and we conduct pre-event briefing. We test the Xiaomi Mi Band 9 with the team and how they're gonna brief to the participants, and we do a proper rehearsal with the team. So next is execution. We do advertisement, we post Google Form as a registration, and we put ads on social media. We hang banner around the town. We pass brochures to the people like at school, mall, universities, and we post invitation on social media. So we run the program. So the next is close out. So during the close out, we gather feedback. We did post-mortem. So after post-mortem, we progress to the report, and we did the final presentation, which I'm doing right now.
Hello, my name is Bmkv and my matrix number is B09221046, and I will be continuing the presentation for our program Smart Health Monitoring System, and I will be continuing on the Gantt chart. So our Gantt chart is divided into 4 stages: the initiation stage, the planning stage, the execution stage, and the closeout stage, in which we start the program from the initiation stage, where we start at 14 October, we establish a group of 5 members, we brainstorm ideas for the project, and after that, we define the objective and scope of our project, and we created a proposal to be submitted to the lecturer for approval. And all of them took 12 days from 14 October to 25 October. Soon after that, we continue with the planning stage, in which we appoint roles and position for each of our members. We estimated the duration of the project, we calculated the budget for the project, as well as surveying the venue of the area. Soon after that, we asked permission from the higher authorities to book the venue for the program. In the meantime, we also arrange transportation for participants, secure funding and sponsor from Xiaomi, prepare emergency supplies, set up PA system, booth, conduct pre-event briefing, and collecting the Xiaomi Band 9 from our sponsor, in which all of them took 71 days, ranging from 22 October to 31 December. And as for the execution stage, we execute the program by first posting the Google form for the registration at 9 December until 29 December, which took 21 days. We posted the Google form registration for 21 days, and then we advertised the event in social media at 9 December to 29 December, also 21 days, in which we will advertise the program and the event through social media such as WhatsApp, Instagram, and so on. And after that, we run the program, and the program starts at 10 January. And during the program itself, we give out the Xiaomi Band 9 to the participants to be used and tested. And the execution stage took us 33 days to be completed. And after that came the closeout stage, in which we gather feedback and review from our participants. We conduct postmortem. Right at the day, we gather the feedback from the participants. We also prepare final report documentation and slide at 12 January to 19 January. It took us 8 days. And finally, we present the project at 22 January. So the closeout stage took us 12 days to be complete. Continuing on the arrow note, which is also called AON, we start by dividing all the activities into alphabets and groups, which is A, B, C, D, E, F, G, H, I, J, K, L, M, N, in which A is the formation of group members and finding the topic, B is defining the event objective and scope, C is finalize topic proposal, D is submitting the proposal, E is appointing position and roles for each members, F is estimating the budget and duration, G is surveying the venue and asking for permission, H is arranging transportation, I is setting up PA system and booth, J is finding sponsors, K is collecting Xiaomi Band from sponsor, L is advertise the event and sending out the Google form registration, M is running the program, and N is conduct the postmortem and gather feedback and prepare the final report. So all of these events have 0 slack except for 3 events, which is A, which is event C, event G, and event I, in which event C has 3 slack, event G has 11 slack, and event I has 5 slack. And the critical part for our event is A, B, D, E, F, H, J, K, L, M, N, in which the rest of the activities have 0 slack, which means they are on the critical path, and this critical path cannot be disturbed or delayed, otherwise it will prolong the program event.
Hi, I'm Muhammad Ashraf Ibrahim, matrix number B09221029. Today we'll explain regarding flowchart and value management. Firstly, the flowchart. The flowchart, we make the flowchart by firstly establish the groups of members, which is our group. Next is the team members brainstorm the project ideas. After we brainstorm it, we define the objective and scope of our project. Does our project objective feasible? Is it logical? If it no, we brainstorm it again. If it yes, we finalize it and submit the topic proposal to our lecturer. Do we get the approval? Does the approval secured? If it no, we brainstorm it again. If it yes, we point position and roles to each team members. After that, we estimate duration and calculate the project budget, survey and ask permission to conduct the project, survey the venue of the event. Does the permission secured? If it no, survey it again. If it yes, we arrange transport and set up the PA system and booth in the day of the event. Next, we survey potential sponsor and collaboration, which is in this case, we got the Xiaomi sponsor and our faculty. Is the sponsor of our collaboration agreement signed? If it yes, we finalize the project. If it's no, we survey again the potential sponsor and collaboration. After that, we advertise and send registration form to the community and advertise about the event, and then we run the program at the event day. After that, we conduct postmortem, gather feedback from the community and the team members, and report finalization. That's all. Next is the earned value management, which is the EVM. By looking at the table in the slides, the EVM shows only at the activity G, H, I, and L. G, which is the survey the venue and ask permission from higher up to conduct the project. H, the arrange transport. I, the setup PA system and booth. And the L is the advertisement of the event. This activities uses our money, our own funded money. It shows that why the EVM tables has only the value at those activities, while the others are the activities that are sponsored mainly by Xiaomi and the faculty. By looking at the table, we can total that the PV is 560 ringgit, the EV is 535 ringgit, and the AC is 560 ringgit. By calculating the variance and the index value, we can conclude that the schedule value variance, which is the SV EV minus EV, we got negative value. The cost variance negative value, and the SPI and CPI we got below 1 value, which shows that our project is always over budget and behind schedule.
Hi, my name is Aisha binti Muhammad Yusuf. I will be presenting expected result and discussion. As you can see from the expected result, it improved community health in Malaysia by reducing stress-related illness, preventing chronic condition, and promoting proactive health practice. It also provides real-time health tracking such as heart rate, blood pressure. Wearable device like Xiaomi Band 9 empowering individuals to monitor and manage their health. It generates valuable health data for policymakers to design better public health program and initiative. For the discussion, simplify healthcare by reducing hospital visit and cost through preventing, monitoring, and line with sustainable development goal 3 such as health, and 9, which is innovation. It ensures successful regular user engagement, awareness campaign, and secure data access for actionable health insight. This can expand reach to elderly and rural community. Next, for the impact environment and sustainable development, we come up with 2 SDG, which is SDG 3, good health and well-being. The system promotes preventive healthcare and early disease detection, real-time monitoring prevent disease and optimize resources allocation. Awareness campaign educate user on the regular health monitoring, supporting SDG 3 by reducing premature death throughout prevention and early evaluation. For SDG 9, which is industry innovation and infrastructure, the smart community health monitoring system advanced healthcare innovative weight wearable technology, enhancing technology capabilities by fostering research. It reduces reliance on physical infrastructure, making healthcare more accessible. And for the conclusion, it improves public health by leveraging wearable technology, addressing stress-related illness, and promoting preventive health practice. It also enhances the well-being of Malaysia working professional and individual with health outcome. It also contributes a resilient healthcare system and foster culture of long-term and sustainable well-being. That's all for me. Thank you.